So at 20 weeks, there is a ultrasound scan again, which is known as the level 2 scan. Why this scan is important is because this is the most extensive ultrasound scan that is being done on a pregnant woman. What all they see is that if the baby's heart is well formed. That is very important, because sometimes, you know, there's certain valves that don't open or close or at time. That has to be seen if the blood flow is proper in the heart. Also, we need to see if the backbone of the child is formed properly. We also have to see if all the other bones of the body, starting from every single bone, you know, the whole hand is traced up to the fingers, and even the smaller bones of the baby's hand and legs, they all counted and seen properly in this scan. So the chances of we missing out any kind of structural defect in the baby is very unlikely after this scan. So the 20-week ultrasound scan is very important. Also, by this time, some women who have not developed certain diseases during their pregnancy, by 12 weeks they might have developed it by now. So this is the second most important checkpoint, where we need to repeat your blood test and urine test. Okay, so that will be done. After that, the third visit would be at 32 weeks. At this time, I'd like to see if your baby's growth is going on normally. I'd like to check it. I'd like to see how the baby's heartbeat is going. Also, we might want to repeat one or two very basic blood tests. After that, the last visit that I would ask you to come to me is at 36 weeks. Okay, so 36 weeks, again, this is the time that you're very close to delivery. Okay, sometimes we have a premature delivery, so you know, 36 weeks is the kind of time that is very scary and skeptical for both the mother and the obstetrician to take decisions about the pregnancy. In case there is a problem, we need to maybe prepone the delivery a little bit. So all those decisions have to be taken now. If the baby is lying abnormally, say the baby is upside down or transverse, like is lying with the back downwards, it gets a little difficult for such a pregnancy to have a normal delivery. So the decisions for so the decisions for a cesarean section have to be taken at this point. So it is extremely important for you to visit the doctor at 12 weeks, 20 weeks, 32 weeks and 36 weeks. I'm stating all these important times, that or the bare minimum or the basic times that you must visit a doctor according to the WHO guidelines and the latest guidelines given by AIMS in Delhi. So this does not rule out the fact that some of you will still need to come to hospital more regularly. You will, if you have any kind of other problem, or you know, that could be pre-pregnancy or a problem that you've developed during your pregnancy, or anything, any of the tests that suggest the baby is not doing well, we might want you to visit the hospital more frequently, maybe weekly, maybe bi-weekly. But these are the 4 times that are extremely essential, right? Also, it suggests that in news and everything, they're covering which hospitals are having maximum number of corona positive cases. For now, the cases are still limited. We are able to contain the infection. So please try and avoid going to the hospitals that have maximum patients, because your chances of getting the infection will be higher. I think visiting your nearby clinics, private practitioners, or the smaller hospitals where you don't have as many corona positive patients, those hospitals will be able to deal with your pregnancy better at this time. Bigger hospitals, especially the government hospitals, are kindly you know, currently very occupied by all the corona patients. So I hope you can judge the risks of different hospital and visit less. Also, all kind of problems that you're having in between, you might be having problems like excessive vomiting, or you know, diarrhea or constipation or swelling in your ankles. We can deal with all these problems telephonically or by a web consultation like right now. So I hope this was useful, and you if you have any kind of doubt or any kind of these extra illnesses that you need a consultation for, we're available for you. You can probably drop in a comment down below, and in my next video I will you know get back to all those comments and answer your queries accordingly. And please, till then, be safe, be at home, maintain social distancing, don't get too anxious, don't get don't get panicky, and you also don't need to get depressed because of all this. This is just a small phase. I'm sure we all will come out of this victorious. We'll be able to contain the infection, and everything is going to be fine, right? And I will also cover anxiety and depression that I'm sure pregnant women are facing a little more than other people, because there's a more influence of hormones during pregnancy than normal times. So the feeling of depression or anxiousness can be a little strong in pregnant women. So I hope all the husbands out there and the family members of all the women are supportive, and they listen to their wives, and because talking really helps. And I will suggest more and more ways that you can overcome all this, and I hope I'm of some use to you guys. Till then, take care, stay at home, stay safe.